but when yours bends in a different direction, you might feel bothered by it. So talk to a urologist, because a bend in your erection might be Peyronie's disease, or PD. It's a condition that involves a buildup of scar tissue, but it's treatable. Xiaflex is the only FDA-approved non-surgical treatment for appropriate adult men with Peyronie's disease.
Popsicle stick.
Along with daily penile stretching and straightening exercises, Xiaflex has been proven to help gradually reduce the
straightening
bend.
exercises.
Don't receive if the treatment area involves your urethra, or if you're allergic to any collagenase or any of the ingredients. May cause serious side effects, including penile fracture or other serious injury during an erection, and severe allergic reactions, including anaphylaxis. Seek help if you have any of these symptoms. Do not have any sexual activity during and for at least 4 weeks after each treatment cycle. Sudden back pain reactions after treatment may occur. Tell your doctor if you have a bleeding condition or take blood thinners, as risk of bleeding or bruising at the treatment site is increased. Talk to a urologist about what your manhood could look like. Find a Xiaflex-trained urologist at bentcarrot.com.
Why are they looking at each other? It's going to be 4 weeks before he can do anything. You know what I mean? Like, that's
just going to help with the straightening exercise.
That's right. But I don't know of any women who've ever complained about this. I don't think that's like a thing.
Well, you better put a poll up. I mean, it's probably this is like, short guys, bald guys, and bent penis guys.
Oh, Brian,
no
how
offense.
offensive.
No. Do we know how?
I know we hit all three there.
How
but
dare you? I'm not short. How do we know how prevalent this is? Like 1 out of 10, 1 out of 20?
Yeah.
Enough to make a medication.
You've been with a
How
guy or two?
dare you?
Have you been with the guy with the bent penis?
He basically said, of all the penises you've been with.
I'll bite on the bent penis. Yes, but it didn't go up. It went it was like a protractor. Yeah.
Oh, okay.
It's like a protractor?
Isn't that, don't they kind of like curve, like?
They list.
Yeah.
Oh, I might be thinking of a slide rule.
Now, does the guy have to move to the side? Or is it like, if he's straight on you, do you feel it and you're like how does that work? Are you feeling it on the side of your...
That's right. That's exactly right. Got to adjust accordingly.
Wow.
So maybe this is an issue, actually.
Well, it's issue enough to run.
It's not an issue for me these days, which is why I put a ring on it.
It's a cock ring.
Yeah.
We've all seen the commercial, so
Indeed.
it definitely exists out there.
Like when lawyers are just wanting to see like how many people would bite on a class action suit.
Mm-hmm.
Are we just trying to see how much interest there is?
Yeah, in like 10 years, you're going to hear like, did you use this? Is your penis effectively broken? Join our class action lawsuit. That's what's going to happen there.
Well, I was trying to read the bottom, which was going really fast during the commercial, but I saw 2 injections.
Ooh.
So, and what is the injection site exactly? On the bend?
Yeah, it's got to be on the bend.
Can you imagine? Have you ever done that? Anybody injected right into the
Never. Thankfully, never had to.
No.
cash and prizes?
No. But I do have that Dupuytren's disease in my hands, and they do inject stuff to try to loosen it up.
Yeah.
And maybe there's a new wave of injectable break up the scar tissue and then straighten it out.
Right.
How do you get the scar tissue? Are you born with a bent, or is it like happen over time because of...
Yeah, what's scarring?
You can be
like, how's it scarred?
You can be born with a bent penis, or it can pop out during vigorous lovemaking and be injured.
Like the cartilage breaks.
Yeah, and then the scar tissue builds up.
You know those glow sticks that get activated?
We use them today. We play hide and seek with them in the dark room.
I feel like this should be a thing that should be happening more.
Well, that would be a tough thing, because I feel like my penis would probably shrink if I was thinking about getting it injected.
Yeah.
On the other hand, there's such a thing as a nervous boner.
No, there's
Yes,
not.
Oh, yes, there is. Yeah, there is.
That's counterintuitive. You have to be happy.
Before I walked in here, rock hard.
Oh, yeah, nerves.
No, but that's a good question.
There's a don't get a boner.
Yep.
But where do you... So, like, if it's, when it's little, where do they know to inject it?
No.
They may need to get a little blood flowing.
Is there a fluffer
right,
in the doctor's office?
Sure.
I love it. This is interesting.
No.
Wait, nervous... Why isn't there a pill for nervous boner? You really get a nervous boner?
Because if you get a boner, it's a boner.
But if you're, if you're nervous about flying, you get a boner on there.
No, there's a don't get a boner.
Right, I kind of understand what that
is. Which is, if the, as I've told you, you get in that physical for football when you're in the 10th grade. Nurse tells you to get down to your underwear. Doctor's going to be back in a few minutes, and you're just sitting there, 15 years old in your underwear, and you're like, no. Don't get a
for
boner.
me,
Not
I remember this happening to me. It would being like, having sweats on and like, just sitting in class looking at somebody and then, Eric, come up and read this.
I forgot how to read.
And then you get up and read and you're just like, whoa, that's.
So it has to do with thinking about a boner. It's not like I'm an arachnophobic and I saw a spider and I got a nervous boner.
No, it's a don't get a boner.
Okay.
Which is like don't sweat.
Oh, yeah.
But she's saying like a fear boner.
That's what I thought you were talking about.
Imagine it had a fear boner. That would be like a condition. Do you get fear boners?
On a roller
like
coaster?
I go like this. Ah!
Oh shit.
I'm ready to fuck. It's like imagine you got to scare me.
Yeah. Haunted houses are just a date rape central.
Yeah, you got to put like vampire fangs in before we like. I don't know. That would be like a weird.
Oh man! Then imagine if you got the hiccups in front of that person, and it was like at a kid's party.
That's right. It's the only way to stop.
Or every time you see clowns, you get a boner.
Kaylin,
it would being like having sweats on and like just sitting in class looking at somebody and then Eric, come up and read this.
I forgot how to read.
And then you get up and read and you're just like, whoa, that's.
So it has to do with thinking about a boner. It's not like I'm an arachnophobic and I saw a spider and I got a nervous boner.
No, it's a don't get a boner.
Okay.
Which is like don't sweat.
Oh, yeah.
But she's saying like a fear boner.
That's what I thought you were talking about.
Imagine it had a fear boner. That would be like a condition. Do you get fear boners?
On a roller
like
coaster?
I go like this. Ah!
Oh shit.
I'm ready to fuck. It's like imagine you got to scare me.
Yeah. Haunted houses are just a date rape central.
Yeah, you got to put like vampire fangs in before we like. I don't know. That would be like a weird.
Oh man! Then imagine if you got the hiccups in front of that person, and it was like at a kid's party.
That's right. It's the only way to stop.
Or every time you see clowns, you get a boner.
If anybody ever travels outside of the U.S. and you go to the Middle East or you go to Mexico, anywhere, if you go into like a kind of a bazaar type place, please, Americans, just.
Respectfully,
they expect it.
Yes.
But then you do the math. By the way, you do the math in your head. Sometimes you're like, wait a minute, the dollar, the peso. Wait a minute, I'm negotiating over 33 cents.